Well, hi everyone, I'm here with my osteo Maddie Fry, also my best mate. We do a bit of training together. It's great to have an osteo that's also very sports orientated, and today I want to talk to you, Maddie, about shin splints. It's one of the things that we get asked about a lot within the program.
Yeah, I can understand the relevance of it as well. Not only do I see it a lot in everyday practice, but it's also very, very common for people who are overweight and they're trying to lose weight as they're getting back into exercise. And there's some really important key facts that I feel you guys need to know about shin splints and how to manage it, and also what to do if you are or appear to be suffering with some of the symptoms around that.
Okay, so common pain that you feel with a shin splint, what happens?
Well, often it's pain on exercise only, and that's how it kind of starts, and it builds up a bit like plaque on your teeth, you know, and then the well starts to increase in intensity and frequency. So it usually starts in or around the shin bone, usually at the front. It can affect around the back into the calf as well, but classically it'll be on the front of the shin bone or just to the side, just to the outside of the shin, on the muscle at the front of the shin as well.
Okay, and it can be exercise induced, and weight, having extra weight on the body can also, I guess, spur it on as well.
Yeah.
Rightio.
But you can also get the shin splints just from being overweight and even just trying to walk with the weight. So
the best thing you can do is get the weight off.
The best thing you can do is get the weight off.
Okay.
And then by virtue of that, you're going to reduce the pressure in the compartment anyway.
Okay. What about management? So you've got shin splints, what do you do?
Well, if you can't do the exercise that you want to do other types of exercise. So if running and walking are your thing, so power walking and even a little bit of light jogging are your thing, and they're giving you pain, stop, follow the RISA rules that we spoke about before. That's essential, and look at alternative exercises.
So RISA's, rest, ice, compression, elevation, and then referral to a specialist.
Correct.
Okay, so we've worked out different exercises. It might be boxing, it might be on the rowing machine, the cross trainer, swimming,
all of those things, and to an extent probably the stepper you could do. But the big rule here is don't give up, guys. There are a lot of other things out there where you can get your heart rate up, which is going to burn your calories, and get the weight off ultimately, and get your shins back to functioning the way you want.
Okay, so you can still exercise around it, but in the meantime, while you're exercising around it, you haven't stopped. You're also then doing some rehabilitation to get it right. Now, how long? I guess it's different for everyone, but what, you'd need maybe 4 to 8 weeks of recuperation, rehabilitation with someone like yourself?
It does depend, and it can vary, but usually we'd say anywhere between 4 and 6 weeks.
Okay.
Because it depends what's causing the shin splints, because there are different kind of types, and the most common one is just because of swelling and excessive tightness and fluid within what we call the compartment, because shin splints are also known as compartment syndrome, where you just get swelling of tight muscles and fluid build up over time. Into that shin complex.
Right, so see a specialist.
Yep.
Maybe massage.
Some self-massage, or get some massage. Acupuncture works really well. Ice is absolutely essential. Yeah. Especially in the acute phase. That's in
the early phase for those of us that don't understand that language. And
I also mentioned rest, but I also want you to take that with a small pinch of salt, because I would love you guys to, if you are experiencing shin splints and you've been diagnosed with it, do other types of exercise.
Yeah.
It's really important you keep going. You work around it, not through it.
Excellent. All right. Awesome. Good. So shin splints, there it is. You've got a little bit of information about how to manage it, how to work around it, and of course go and see a specialist like Maddie. Thanks, Maddie.
Pleasure.
Bye.
Bye.